My name is Hyginus Omeje. I'm the Sector Commander for Federal Safety Corps Lagos. Well, I got to know HEI through Mr. Patrick and Pascal. And I think I was just in the office one day and he came in and was explaining the whole concept of the HEI to me. And it was all about meeting the needs of indigent patients and people that really fall within that line, mostly as it relates to our job when we carry crash victims to hospitals and you discover that nobody to, take care of the victim hereafter. And some of them will get treated and cannot even leave the hospital because nobody has paid their bills and things like that. And I saw the passion in him in ensuring that this category of people do not really suffer to death or suffer the kind of hardship they are going through because of little funds, as little as 10,000. Somebody will be in the hospital. And we've had cases where even some hospital will tell you they're not going to touch the patient until even somebody buys card and do all those things. And I saw what the concept of HEI is in terms of coming as a bridging gap in all this. And also you go to some general hospitals or even community health centers where for prescriptions of 1,105, the woman cannot afford it and the child is dying of malaria treatment, of malaria, and they can't even afford bills as little as under 5,000 naira. So, but the one that caught my attention most is actually how it relates to crash victims that we do drop in the hospitals. And I got interested and I think I said, okay. Personally, I even enrolled myself as a member of the HEI family so that I can also contribute my own quota. And subsequently, we came up with a memorandum of understanding of how FRSC and HEI can actually work together on a project we call non-shooter. We have leveraged on that relationship to gain some mileage. On their parts, when they started training volunteers, our personnel, as first responders, some of our personnel have benefited from that training. And we have joined them in the awareness campaign of also raising the awareness of what the NGO really stands for, with a view to wooing others to really voluntarily join and see how we can all, meet the needs of indigent patients within Lagos State, and ensure that for minor cases, people don't lose their life where it ought not to. Some of us have so much that we even go abroad for any little headache, but we have people here who cannot afford to even pay general hospital bills for malaria, ordinary malaria. We have crash victims that at times I have had cause to pay for card before they could attend to the person. And also the person is in a hospital. Hospital is saying that somebody deposits 5,000 they cannot treat. So nobody to do anything because so we have collaborated in raising that awareness so that more people can really join this initiative and ensure that together we save lives, of crash victims and of course non-crash victims who, for financial incapacitation, we should not allow them to suffer to death. And I am happy with what they have been doing in recent time. I was not able to join in the last awareness walk they did because I was not around, but then again, I've been also tracking their activities in recent times to be sure that we are still on track, and I think they are still on track. I think I should use this opportunity to appeal to any good-spirited Nigerians. This is, I know what the issues are here. Most NGOs we've had in this country, everybody is focusing on HIV and AIDS, where the international donors are bringing in money. Well, this is something I see local content in it. We should be able to have an NGO like this that is addressing what is real to us. And to me here, what is real is, look, crashes are occurring daily. People go to hospitals, they cannot even buy card. In the first case, one pathetic case about crash victims is that you cannot get to know the relatives. Then, at times, some people will stay for how many days, you have not been able to know where they are from, where they are going. So I want to appeal to Nigerians and Lagosians in particular for us to, as God has given us the grace, we should really identify with what HEI is doing. There are a lot of indigent patients there who need help. And I think everything God has given us is not just for us. It's for us to use it to serve Him. And to serve Him is the people you see. God you can see. But the scripture made us to see that whatever you have done to the least of these ones, He said you have done it unto me. So I think it's one area that I really want people to look at. Each time I'm watching AIT News Hour, you see they put somebody, heart surgery, kidney this. I want to see a situation if we can all grow in HEI such that such is, and you not look at it, you say the person needs 2 million naira, the person needs 6 million naira. There are people that spend 2 million naira in clubs in Lagos State. So I think these are areas we should all join hands in this service to humanity so that we can all save lives. Nobody is going to carry anything out of this world. Everything we have is going to end here. So I think we should use what God has given us to serve humanity and to serve God. So I encourage you out there listening to me, if you are moved, please join HEI. I joined, and I'm working with them too as the Sector Commander Lagos, as my organization in road safety in Lagos. They are my stakeholders, and together I know we can all make a difference.